one of the things that happens is that when we try to get results, sometimes we look for this situation of perfection. And if you look at God creating the world, when he says in the 6 days that he creates the world, he doesn't say the word perfect after each day when he's done. He says, and he looked at it and he saw it's good. The difficulty is to understand when enough is enough and what is really good and what sometimes a little bit beyond it may be actually bending to the point where it becomes from good becomes bad. And when you inject certain areas with material that's supposed to last forever, well, it may be good in the short term, but in the long term it can have significant consequences. One of the things that happens, one may consider not the worst that would happen, but just a common occurrence, is that the silicone causes the skin around it to continue to regenerate. And when you listen to it, you may think that's okay. It's okay, except it regenerates at its own rate, not at the rate in which we age. So as you look over here, what happens is with time, those lines, indeed, she doesn't have the lines, but with time, this started to protrude and become much more like a horn, which her daughter told her, Mom, go take care of it because it looks like you have, a rhinoceros over there. And it's not the muscle. This is the silicone. The other problem with the silicone is it migrates. It moves away from where you inject it. So did I ever inject silicone? I've injected silicone. Where did I inject it? Under, I did not want to, but I did, into acne scars on the face. It does last long, and it was micro droplets. So when you inject, you don't even see the material coming out of there. It's micro droplets, and you don't see a result. And it takes about 6 months before anything happens, and you do once a month, very, very small sessions. Not the way that this was injected. It was injected to make the lines go away. And when that happens, it's overdone. And again, there are other issues that can happen with silicone, and you've seen some of those cases where you can get an infection, where you can get, when a person is on certain medication, it starts indurating, starts inflaming, hurting. So especially in this area where there are nerves involved, because there's the supratrochlear and supraorbital nerves that are passing right in those areas, you are at a high danger of compression of arteries, compression of nerves, pain, occlusion, and blindness. So you need to be really, really careful. What we're going to do right now is try to soften it a little bit by reducing the amount of collagen that's produced around it. And the way we're doing it is we're using steroid injection, cannula injection, carefully into the areas where the silicone assumed injection area was. So I'm palpating to see where exactly the area is. It has it. Here we go. Good job. Yeah, this is definitely the area. So when you feel it harder, then you know that's the spot where it was. I'll take another point one. So no sooner than a month, we can inject a little more. Again, we don't want to overdo it. You will not see results right away. It takes a while for the collagen to stop overgrowing, or in this situation to actually, we want it to atrophy a little bit, so that this is not going to become a very depressed, but actually a natural look. You did very well. Very painful? No, not too bad.
No.